welcome back to my channel. My name's Annalise Garrison, and I'm your NCLEX tutor. And in this video, we're going to be doing step 2 of the clinical judgment measurement model, and that is analyzing cues. So we have the same case study. I'm not going to read everything, ladies and gentlemen. I'm just going to do the question. If you need to read the question again, I'm going to refer you back to the video of recognizing cues. So this will be step 2 or part 2 of the clinical judgment measurement model, analyzing cues. All right, so get comfortable, get your coffee, your soda, whatever you need to get, and let me explain this to you. Let's get started. Welcome back to my channel. I hope you had a wonderful Easter. And now we're going to pick up where we left off with the question here. And the second step of the clinical judgment measurement model is analyzing cues. Now, when we analyze cues, ladies and gentlemen, what are we doing? We're kind of connecting the dots, right? When we recognize the cues, we just recognized what was wrong, okay? When you analyze the cues, you take what's wrong and you say, why is this happening? Basically, you connect the dots, okay? So here, question 2, analyzing cues. It's a good idea, it's the same case study. Always check your tabs. Make sure there's no new information, and the only new information we have is at 8:15. The nurse reviews the nurse's notes and assessment findings. So we're reviewing things, we're analyzing things, right? So we read the question. For each client, check to specify if the finding is most associated with infiltration, phlebitis, extravasation, or infection of an IV site. Each finding may support more than one condition. So extravasation is just fluid going from one area to another area. Now when you do these types of questions, it could be one or it could be all of the answers, right? So the way to think about this is basically connecting the dots. So the client is experiencing a temp of 101. Could that be due to infiltration? Could that be due to phlebitis? Could that be due to extravasation? Could that be due to infection? Right? Well, if we think about it, we know that phlebitis may cause a temp because inflammation, right? And infection may cause a temp. So we would choose that, phlebitis and infection. Now, what's causing discomfort at the IV site? Connect the dots. What could be causing discomfort? Could infiltration be causing discomfort? I'd say yes. Could inflammation of the veins be causing discomfort? Sure. Could fluid moving from one area to another area be causing discomfort at the IV site? Sure. Could infection be causing discomfort? Yes. Connect the dots, think about it. A reddened skin at the IV site. Could it be red due to infiltration? Yes. Phlebitis? Yes, I would think so. Extravasation? Yes. Infection? Yes. Swelling at the IV site. Well, that could be due to I think phlebitis, an infection. You see? Connect the dots, right? Let's see what else we have. Warmth at the IV site. Excuse me. Warmth at the IV site. That could be due to I think the phlebitis, possibly infection, streak formation at the IV site, due to phlebitis for sure. I just think phlebitis. And what about palpable cord-like vein? That's definitely phlebitis. So, when we're done answering the questions, let's check it again. And are we happy with our answers? I am happy with the answers I chose here. So, basically, recognizing the cues is writing down what's wrong. Analyzing cues is connecting the dots. What could be causing the symptoms? What could be causing the symptoms? All right. So we hit submit, and I missed a couple here. Scores 12 out of 16. So let's see what I missed. It seems like I missed a couple. I missed 2 here. Okay. I should have picked infiltration and extravasation for the reddened skin at the IV site. Okay? Everything else is correct, I do believe. Let's see. Yeah. Okay. I picked infiltration and extravasation, and I should not have. Okay. All right. But, so that's a pretty good score. I would say 12 out of 16 is pretty good, right? And it's okay to get some wrong on the NCLEX. You get partial credits for questions like this. So this is not bad at all. So reddened skin at the IV site, I picked infiltration and extravasation, and I should not have. That's the only thing I got wrong. All right? Everything else is correct. And so then we would go to the next question. And this is where we want to prioritize hypothesis. Now, prioritize hypothesis is your nursing diagnosis. And we will discuss that in the next video. All right? So have a nice day today. Study hard. I am taking the emails and the phone calls from that medical school in Florida everybody's having a hard time with. And I don't know if I can help everybody with everything. Okay, some of you are calling for, ATI refreshers. What I'm going to do is everybody just email me or call me. I'll set up a Zoom meeting and see if and how I can help you. Because, the nursing students here don't just, you're having problems. You're not necessarily studying for the NCLEX. So let me just make this blanket rule. Anybody that needs help, call me. We will set up a free Zoom meeting, right? We will set up a free assessment, a free conference, and let's see. We'll take it from there. Okay, guys? All right. God bless you, and I will see you in the next video.